Hey everyone, Dr. Tam here. Today I want to show you what is a trigger point, how do you diagnose it, or how do you know you have it, right? So first off, what is a trigger point? This is a muscle fiber. For any of you who don't have any medical background studies, this is what a muscle fiber looks like under a microscope. In every muscle fiber, you have normal strands of muscle fibers, then you have the knots that have built up, and then you have another area between the knots where the muscles are overstretched. Then this is what a healthy fiber looks like. But a knot over time sometimes is caused by chronic pain, injury, stress, poor posture. It can cause these muscle fibers to really knot up in there. And what you notice is when you press on most of the time in the shoulders, right next to your neck right here, you're gonna feel, whoa, that's a really tender spot right there, a painful spot, and that's what a trigger point is. Now, trigger points can happen all throughout the body. Every yellow dot surrounded by a red ring is a trigger point area that can happen in these areas. Now, these are some common ones though that I want you to take a look at. There could be right along the neck in here. You can have some, what I talked about earlier was the ones right along the shoulders. Okay, then there are ones along the shoulder blades, in your upper arm, your elbows, lower back, right? It could be in the front or the back of the arms over here. Lower back, the hips, it's very common. And also your legs in the front and the side, also all the way down into your feet as well. Now, these are 14 major trigger point groups. These are groupings of trigger points. You may have some in your jaw that can really lock up in the masseter muscle. When that locks up, it's gonna cause a lot of grinding and eventually TMJ problems. In your chest, it's going to cause a lot of tightness here, and that's where your posture will start rolling forward, which then causes more trigger point problems in the back as well. This one's the back of the body, and you may have some in the suboccipital muscles right underneath your skull right here towards the top part of the neck. This can cause a lot of headaches over here. In the back, right between the shoulder blades, it's going to cause a lot of tightness right along the mid part of your back. And then also in the arm, which can cause sometimes tennis elbow or golfer's elbow as well. In your lower back, this will definitely cause a lot of lower back pain, hip pain, and then all the way down the side of your leg and in the front of your leg. A lot of times causing either restless leg syndrome, or you might feel like, wow, I just have to move my legs all the time because the muscles are all knotted up down there. The next area is, I want to talk to you about refer pain, because just because a trigger point is in one area, that doesn't mean it can't refer, and most of the time it will refer to other areas. For example, on your neck here, right along the side of your neck, when you have a trigger point or a knot here, it will start to flare up and cause a lot of tension headaches all over the side of your face, behind the eyes. A trigger point in the mid-back area can cause pain all throughout the back between the shoulder blades. And also every color on this video, you probably right now have to pause it and take a look at it, will cause different pain in different areas. For example, you notice there's no trigger point in this area along the arm, but a trigger point in the middle of your shoulder blade can now cause pain going all the way down the arm. For example, the trigger points in your shoulders can cause pain up the face. Trigger points in your mid to lower back may go all the way down to the buttocks, okay? So ultimately, that's what a trigger point is. If you have any questions or you think you may have trigger points, make sure to feel free to contact our office today.